Hi, Dr. Anita Kunnaya, Senior Consultant Laparoscopic and Robotic Surgeon from Yashoda High-Tech Hospital. Today we will talk about postmenopausal bleeding. And every one of us should be aware of this term called as postmenopausal bleeding. Why? This term is once said when a woman have completely stopped having periods for at least 1 year and then suddenly starts having a periods again is called as postmenopausal bleeding. This phase itself sometimes scares most of the women, but at the same time most of them think that it is quite normal, there is no need to visit a gynecologist, but it is not like that. Any women who are having these symptoms have to visit your doctor immediately. These conditions of postmenopausal bleeding have little high risk for having abnormal conditions inside your uterus or in your cervix. What we are worried here, the risk of malignancy in a woman with postmenopausal bleeding is around 8 to 10%. Women who are still having periods more than 55 years, who are having extremes of obesity, hypertension, diabetes, and who are also having family history of any kind of endometrial cancer or ovarian cancer have little higher risk of these condition of postmenopausal bleeding. They have to come immediately for the attention to evaluate. The postmenopausal bleeding cause can be anywhere from the vagina, cervix, uterus, tubes and ovaries. Commonly what we see it is as, along with the postmenopausal bleeding, if you have foul smelling vaginal discharge, we need to rule out any kind of cervical pathology. Commonly what we have to evaluate is cervical cancer. Second most common is the endometrium, that is the innermost layer of the uterus can have abnormal growth, polyps or any kind of mass which cannot be neglected. Third common is your ovarian cancers or ovarian pathology. Any woman coming with postmenopausal bleeding needs to come to the attention of your gynecologist immediately. Please don't postpone. Your doctor will immediately examine you clinically, rule out any kind of local causes first, get a pap smear done, and the basic test what you have to do is an ultrasonography, that is preferably a transvaginal ultrasound scan. What do we see in this? We normally see any kinds of abnormal growth or polyp. Normally, the inner layer of the endometrial cavity for any woman who has attended menopause will not be more than 5 millimeters. But a woman who is having bleeding, and if the endometrial thickness is more than 5 to 7 millimeters, you have to get evaluated. If any abnormal pathologies are found in an ultrasonography, there are two simple tests done by a doctor. One is an office biopsy, what is called as papillae biopsy. We put a small catheter inside the endometrial cavity and take any tissues from the endometrial cavity, provided your pap smear is negative, and send it for an analysis and test. But sometimes these papillae tests can have negative results or false positivity, but the gold standard, what we call it as, is an hysteroscopy. Hysteroscopy is a small laser scope similar to what we call it as laparoscopy. Hystero means uterus. A small camera is introduced into your natural passage via your cervix, and directly under vision we inspect your entire endometrial cavity for any pathology. And under vision we take the biopsy and send it for the test analysis. This is definitely a gold standard test and not to rule out any other pathology, provided you are not a known case of pre-existing malignancy or a medical issues already. Once you do this, the biopsy results will come and tell you whether these polyps are growth or leading to any cancerous changes or no, because the incidence of these are almost around 8 to 10%. So any one of you who are having postmenopausal bleeding, who have started having new symptoms, please don't neglect. Get yourself checked up immediately, or sometimes routinely get your annual health checkup done. For all the women's, pap smear is must to rule out any cervical problems, and when you are getting yourself checked up, an ultrasound scan as a routine health checkup is always a better. And if you have any family history of breast lump or a cancer as well, please get your mammography also done. Thank you.